Emanuele Capobianco regarding the humanitarian situation in Gaza. He's the Chief of Strategy and Impact Officer in WHO Foundation. Good to see you. Good to have you here with us on TRT World. About 3-4 minutes ago, we highlighted what the World Health Organization has said about the unfolding situation in Gaza. Basically, WHO is warning that diseases could kill more people in Gaza than Israeli bombs. I wonder how significant this statement is. What do you think is the kind of message World Health Organization is trying to send?
Thank you, Jafar, for having the WHO Foundation on the program. Let me just link to one word of what your correspondent was saying earlier. Right now, with the humanitarian pause, trucks are crossing the border, bringing essential medical supplies to people in dire need. This is part of a good news, but the number of trucks that are crossing is just too small compared to the needs out there. And what we have in terms of the situation is a very complex and dire humanitarian situation. We have 1.8 million people displaced, half of them children, all crowded in areas where access to safe water is available for 30%. 70% of these 1.8 million don't have access to safe water. If you think about sanitation, there is on average one toilet for 220 people. That means that people are defecating in the open. They are not getting access to safe water. So what we are seeing is an increase in acute watery diarrhea. And this increase has been 45 times of what we have seen in normal times. At the same time, it's cold, it's raining, and children that are already malnourished are getting severe infection on the respiratory tract, and we are seeing increasing case of pneumonia. Put all that into a system where medicines are not available, where 28 of 36 hospitals are shut down, and what you can see is a very critical situation that can lead to the death of many hundreds and thousands of people. So that remark from the WHO Director General is to be taken very seriously and is something of great concern.
Emanuele, I think it's important to underline here that even before the 7th of October, Gaza was facing a humanitarian disaster where more than half of the besieged enclave's population was dependent on humanitarian assistance. And since the 7th of October, the situation has certainly only gotten worse. Let me ask you, if there is no intervention of any sorts when it comes to protecting these children from diseases, based on your experience covering pandemics and epidemics, what are we looking at? Where are we heading to?
Well, we are heading, unless the humanitarian pause is continued and a sustained ceasefire is put in place, we are heading into a situation where we are likely to see outbreaks of various types of diseases. And particularly, we're going to see a lot of children dying because of acute watery diarrheas, because of pneumonia. We're going to see children dying because of lack of services when children are born. The lack of electricity, the lack of fuel makes a newborn that has the need of intensive care unable to receive that. And that means the death of a child. We are seeing, though, also complication beyond children for other people. We have 350,000 people living in Gaza with chronic conditions. They may go from hypertension to diabetes or cancer. Without medicines, without access to services, those patients are going to fall more and more ill, and many of them are likely to die. So what is imperative at the moment is to have a sustained ceasefire that allows the entrance into Gaza of more and more trucks. Your correspondent mentioned 200. Before October 7th, there were 500 trucks already getting in. You may imagine how much the response needs to get bigger and with greater access to all the humanitarian actors that are trying to support the population to get access to life-saving services and life-saving medicines.
Emmanuel, in the past, you have held many leading roles in different societies, healthcare organizations, including UNICEF. You were UNICEF Mozambique's Chief of Health and Nutrition. I want to ask you something on a personal level. Have you seen something like this before? Have you seen something like this before, what's happening in Gaza right now?
I've not been able to be in Gaza, so I have not seen the situation on the ground. I am reading, I'm watching, and I'm personally very distressed by what I'm seeing. The number of fatalities is enormous. We have. If I'm thinking about the impact on people on the ground, the lack of access to water, to food, to medicine is extreme. We're also seeing unprecedented loss of lives in the humanitarians that are providing services, and we had the highest number of UN officers ever since the creation of the UN during the world. It is for all these reasons that we, as the WHO Foundation, are trying to raise resources to bring medical supplies through WHO and the partners that are working in collaboration with WHO to bring medical supplies, emergency kits, vaccines into the hands of those very brave health workers that are on the ground, that are trying to provide services in very difficult situations. They are the heroes of this conflict. They deserve the support and the admiration of all of us.
Indeed, well said and fascinating insights into the topic. Emanuele Capobianco, thank you very much for talking to us here on TRT World. Really appreciate your taking out the time.